Okay. And then thanks everyone. I'm just going to ask that everyone also stay muted until the end, just so that we can save the end for questions, which Olivia will talk through in a couple moments. But we're very excited to be here. We have these educational seminar series once every month. This is a monthly webinar, and we make it free for the community, which is made possible through our metric grants, which SAMHSA and NCTSN support us with, which we're very grateful for. You are welcome to go to our website and follow us on social media or email if there are any questions during this time. But today we're going to spend some time on our presentation, and then we'll jump at the end to some questions. All right. So I think you all can see our introductory slide here. Today we'll be focused on parent-based interventions, which is a big part of what we offer and include here at the Center for Effective Therapy. And just to introduce ourselves, hello, my name is Mary. I am one of the independently licensed social workers here at the Baker Center. I'm also the assistant director of our Waltham location. We have 2 locations, one in Mission Hill and one in Waltham. And then I'll hand it off to you, Olivia.
Great, thanks, Mary. So my name is Dr. Olivia Conover. I'm a staff psychologist primarily at the Boston office location for the Center for Effective Therapy at the Baker Center. And thanks, Mary, for getting us started. So we can talk about, like Mary mentioned, for questions. I'm going to ask that we hold questions until the end. If you need to kind of write it down and put it in the chat, we'll answer them at the end too. Neither of us are going to really have the ability to monitor the chat too much throughout the presentation, but we will try to answer the questions at the end in the order we receive them, and then also open the floor to more questions depending on time at the end of the presentation. So let's get started. So we're talking today about parent-based interventions. And what's really fun is that the parent-based interventions, sorry, my computer was prompting me to restart. Parent-based interventions are one of the things that you might get offered when you go to various clinics, and particularly here at CET. And so when does this become an option is one question. First, when you come here to the Center for Effective Therapy, you're going to complete an intake assessment, which is going to provide diagnoses or recommendations, and just a history of what's going on for your child. And there's a couple of different categories of different interventions that could be recommended. One is individual therapy, which I think everyone as a society, we're more familiar with that idea of going to a therapist, one-on-one, talking about your issues. And I put a little star there because for kids, individual therapy usually always has to involve the parents in some way, or the caregivers in some way. But that could be one recommendation. Another could be caregiver-based interventions, which we're going to talk about today. Another could be additional assessment, evaluation, referral to different agencies, or even no treatment. So just to give you an idea of where this might fall and when it might come up that this gets recommended, it really depends on the presenting concern and what's going to be most helpful for the issues that the child is facing, and that the family is coming in with. And as we talk about the different interventions, that make up caregiver-based interventions, that'll make more sense. So what is a caregiver-based intervention? What does that mean? What it means is that the child is still the patient. So the child is still the one that's coming in with the presenting concerns, but really the parents or the caregivers are the active agent of change in treatment. So they're the ones that are meeting with the clinician. Sessions are often held primarily with just the therapist and the caregivers. And the session work, the kinds of things that we talk about changing and working on, is often assigned to the caregivers. So homework, things to do in between session that will help address the problems, that's actually given to the caregivers to work on rather than directly to the child. And so the idea here is that parents are sort of the conduit of change in the child's symptoms. And that's what leads to change in the child's behavior is actually first change in the parent's behavior. So why do we recommend caregiver-based interventions, which is something we recommend quite often here at the Center for Effective Therapy? And it's for a few really good reasons that are supported by the research in child psychotherapy. One is that children are really strongly influenced by their environment. This is something that I think resonates with us if you have children, or you interact with children, or you work in childcare, is you really see the influence of the environment. And caregivers are a big part of that environment, and thus are a good place to start intervening to help change how kids are going to behave and how they're doing. In fact, there's sort of a better place to intervene when you think about it that way in terms of the big impact of the environment than the child meeting once a week with a therapist. Often the individual therapy model is once a week with a therapist for an hour, but caregivers spend a lot more time with children and thus have a lot more opportunities to be influencing them and to be helping them and supporting them overcome whatever difficulties they're coming into treatment for. The last point here is really that another reason is that we know children often are not super motivated to change their behavior because of their age, insight level. Maybe they just don't quite have the cognitive developmental abilities yet to really make changes to their patterns of behavior that are going to help them deal with emotions and moods and anxiety or whatever it is they're coming in for. They might not have the motivation, and caregivers are often more able to make those changes and are more motivated to make change and have more abilities in terms of just being adults, fully developed frontal lobes, ready to make some change for their kids. When, since we recommend a lot of caregiver-based interventions here at the Center for Effective Therapy, we definitely run into the most common concerns a lot, and understand where these are coming from caregivers for sure. And so it's something that often gets talked about in the intake assessment or in the first couple of treatment sessions with parents, where there is some understandable hesitation about, bringing your kid in for an emotional problem and being told that the sessions are actually going to be with you as the caregiver. And so some concerns are things like, oh, does this mean since you're recommending working with me, does that mean it's my fault? And definitely not. I think the way that we think about this is more that it may not be anyone's necessarily anyone's fault. It's often a big combination of different factors. And maybe it really is like something to do specifically with the child and their temperament or their mood or something that happened. Um, so caregivers aren't to blame, but they're often still the most effective way to change the problem. So just because caregivers are not to blame doesn't mean that we can't make the best use of them to help in treatment. It's sort of like when a kid gets sick and has a cold, it's not the parent's fault that they're sick, but the parent is the one that can go to the doctor and get the medicine and help give them the medicine to make them better. Um, Same thing, another concern where it's like, well, I'm not the one struggling as the adult, my child is the one struggling. And just a reminder that the kid is still the patient. It's just that the medication is being delivered by meeting with the caregivers, and having the caregivers make changes for them. Another concern, is for caregivers that have multiple children or have had multiple children. is, well, my other kids are doing okay, so how can it be that like I could have an influence over this child and this problem? Um, and this is again thinking about different kids have different needs. It's true that like one approach and one way of supporting one child might work really well for that one child. And there might need to be a different approach for a different child, just like one child might need glasses and another child might not. It's just a different way for different kids with different needs.
Thank you, Olivia. Next, we're going to really jump into what some of the specific interventions are that we do here at CET. So at first, an overview. We'll touch on behavioral parent training, supportive parenting for anxious childhood emotions or SPACE, and then parent-child interaction therapy and some of the variations there. All right, first, behavioral parent training or BPT. So BPT is designed for kids and teens around the ages of 6 years old up to 17 years old. So, first, it's important to note this is a frontline treatment for children and teens experiencing disruptive behavior challenges and ADHD, in addition to being a supportive intervention for children experiencing anxiety, low mood, and or who have been impacted by traumatic stress. Um, we talk a lot about BPT being something that can be either a standalone treatment with just caregivers, depending on what the top concerns are that families are coming in with. And there's a lot of families where we might start with BPT with caregivers before we're jumping into individual treatment, which we'll talk a little bit more about. We will talk also later about PCIT for our younger kiddos, but when we have some younger kiddos, maybe that 5, early 6 range, where behaviors are a little less impairing, BPT strategies can also be very effective. So then thinking, if you do participate in BPT, for short, what do you learn? So big picture, you're really learning ways to manage and improve your child's mood and their behaviors. Some of those larger concepts we first work through and learn about are just the principles of behavior and really learning how to use attention as your superpower as a parent or caregiver. There are very specific skills that we're going through in each session. So increasing positive or pro-social behaviors through things like one-on-one time and labeled praise, using differential attention to decrease challenging behavior, finding ways to give really clear instruction to kids, and then finding ways to use rewards and consequences. Later on in the course of treatment, we also work to generalize skills in the school and in the community. And one thing that's really powerful as we're making these changes in the home environment, we tend to see things improve in other settings. But oftentimes our clinicians are also able to consult with schools and support families in thinking through how to take some of these strategies and make them also fit into the school in a way that makes the most sense. So big picture, we're really looking to use the role of reinforcement, thinking about our response to behavior as parents or caregivers, and how to strengthen that child and caregiver relationship in the process. So as Olivia mentioned, these interventions tend to involve caregivers. And at first, caregivers only. Sometimes with BPT, it's only caregivers through the entire course of treatment. So what that looks like when it comes to evidence-based care at our center is we always set up weekly meetings to review principles and skills. The rationale here is when we're teaching skills, when we're implementing skills, we want to have that regular touch base to make sure we're keeping this up very consistently and because these skills really build on one another. In between sessions, caregivers are given a skill and then given something to work on to practice implementing the skill in the home with their child. And then after you do that, coming back to the session to review how home practice went and really problem solve any implementation barriers. We talked a little bit about the skills in the last slide, like one-on-one time, labeled praise, using differential attention to decrease negative behavior, giving instructions, rewards, consequences. This can be really common language for parents and caregivers. And we sometimes do get that feedback. Oh, I do these things, or I have done these things. And sometimes what we're doing is really working with caregivers on their solid foundation of the skills to really tweak them to their individual child and really use that attention to increase the behaviors we want to see. And sometimes also scaffold that to help teach new behaviors and build the skills for the kiddo themselves too. So that implementation piece is so hugely important. And sometimes learning the skill and implementing it can be really two different things. It's hard to do. And that's where having the clinician there to really kind of serve as your coach can be so hugely helpful for these situations. And again, all of this builds on one another. So once a skill is being implemented successfully, then the clinician will introduce that next skill. So you can see this graphic that Olivia had in her previous slide around how the therapist is working with the caregivers to help tweak and coach, and then that's having the impact on the child. I will say too, we talk a little bit about how implementation can be challenging. And I think that's true. And I say that both as a clinician and as a parent myself. I know these skills and implementation is still sometimes challenging. So having a coach, having a therapist there to think through implementation and talk through the challenges can really make a difference. And in some instances, depending on the kiddo's age, depending on what's going on, our clinicians also sometimes offer live coaching to support parents and caregivers in implementing these skills through live coaching, where we might Zoom in or have you in the office where we're able to do some coaching with some of the technology that we have to do that. We also do things like role plays, problem solving around skill use, coming up with really specific times of day. So we're getting into that nitty gritty with folks. I will say too, there is some good, we'll have some references to the research that we use to really put together this presentation at the end. And I think one thing to note is I know, again, Olivia mentioned a lot about, when it's caregivers only and not including the child and some of the questions folks might have around that. We're really fortunate to rely on a lot of long-term research that has been studied over time. And in short, what has been found is that BPT, especially for disruptive behaviors, is really more effective than other treatments. And the average youth whose parents did BPT did better than over 82% of those who did not. And that adding in that child-focused component to behavioral parent training does not always increase its benefit per the research. And so that's been something that's been really helpful and I think sometimes counterintuitive in how we understand treatment and therapy. But also, I think, both as a clinician and as a parent can help empower us to know that we can make change in different ways in terms of how we implement these skills. So thinking about the benefits. So when we're really thinking about BPT, benefits for a caregiver might be improving the caregiver's relationship with their child. I meet so many caregivers who do really value and really try to prioritize that relationship. And oftentimes when there's challenges going on, whether it be with behavior or low mood or even anxiety, a lot of the interactions can either turn into conflictual or just highly stressful and intense. And being able to give folks those moments of positive can be really powerful both for the child and for the caregiver. And we get more into that as we discuss the skills too. And so it's not the lack of positive relationship, but building the potency of that and giving you those moments, which can have an impact ultimately on behavior and some of those other symptoms that folks are coming in concerned about. It helps improve behavior in the home and other settings, which is really what caregivers are coming in for oftentimes. That's really the crux of it. It can really also boost the caregiver's confidence as a parent. I think there's no perfect guidebook on how to be a parent. And sometimes that can leave us feeling like, what is my next step? How do I take this on? Is this in my circle of control? Certainly not everything is, but being able to have some skills and strategies and know how to respond can be really empowering and can also help us feel confident, both when in the course of treatment and later on in life too. And then again, despite the fact that kids are not typically involved in BPT directly, There are a lot of benefits for the child. There's more positive interactions with the caregivers, which is a win-win across all settings. Can boost the kiddos' self-esteem through some of the strategies and skills we're using, and as they're seeing themselves be more successful. It can also help to improve social interactions, and then also increase the ability for them to participate in those settings. So if these behaviors or symptoms are having an impact, say in school, community settings, extracurriculars, preventing them from participating, that is a huge boost for a kiddo to be able to more effectively participate there. And of course, needless to say, a win for caregivers too. So next, we're going to jump to supportive parenting for anxious childhood emotions, or SPACE. So this is a parent-based approach, really meant to target kiddos that have experienced anxiety, OCD, related symptoms. This can either be used as a standalone, meaning this is really all that we incorporate in, or our only intervention, depending on what the parents and child are describing. And sometimes it can also be done as a first step, foundational step, prior to a child coming into treatment. So you can see some more information on SPACE, and the creator is listed here if you go to spacetreatment.net. Again, another evidence-based intervention. So I mentioned really anxiety-related disorders are when we use SPACE. Here is a list of some of the anxiety-related disorders that we might think about. So you can see some listed here, anything from OCD, generalized anxiety, selective mutism, social anxiety. And I think it's really important to know it is not uncommon to have a child that might be ambivalent about treatment when they're experiencing anxiety or resistant to treatment. Treatment for anxiety involves a lot of exposure, and that can be hard. And so I think having something that is parent-focused, caregiver-based can be really important when it comes to anxiety, because it's not uncommon to have that. Again, low motivation for various reasons, including the challenging nature of treatment or the low insight that a child might have on the impact of their anxiety on their functioning. So when a child's not motivated or aligned, that's a place where SPACE can be used. And certainly we also incorporate aspects of BPT to really think about how to support behavior as we're moving through that too. Okay. So a very, again, a big overview of what's reviewed in SPACE. With any intervention, we're always first learning about, behavior, anxiety, and how those present, because having that understanding first and foremost can really ground us in the work that we're doing and the approaches we're taking from that point forward. Big picture in SPACE is we're always trying to first think through how can we respond supportively. And I will say, for children and adolescents with anxiety, all families are typically responding with a lot of support. And part of what can happen is that support can turn into accommodation. We almost overly accommodate the anxiety because it is so distressing for our kids. And so the other goal is to better understand what accommodation is as it relates to anxiety, meaning what are the things that we do to accommodate the child's anxiety, maybe giving them a ride to school instead of the bus, or really thinking about how we're walking them to somewhere as opposed to them going independently. So thinking about various points of accommodation, and then finding ways to very gradually reduce the accommodation that we're providing as parents. And so for children and adolescents, again, family accommodation is so common that researchers estimate as many as 95% of parents and caregivers of anxious children make changes to their own behavior to try to reduce child's anxiety. So for any parents, caregivers out there with an anxious child, please know this is incredibly common. And acknowledge, we also want to acknowledge caregiver instinct to support their child when anxious. When we see our child in distress, it is so much an intuition to help. And so this strategy really helps to maintain that support, but then also think through how can we gradually reduce those accommodations, as I mentioned. Because a lot of the time these accommodations can accidentally actually maintain the anxiety, keep the anxiety strong. And so that's one of those ways we can really take that on without the child being an active participant by decreasing the reinforcement of anxiety while maintaining support. So again, what are some of the benefits for the caregiver? So as we've said before, just really empowering a caregiver to identify where you can be an agent of change, especially in anxiety-related disorders. It also reduces and cuts down in the amount of time caregivers are spending accommodating anxiety, which can be tremendously helpful. As a parent, as a caregiver, we can fall into patterns, we can fall into routines that are really dictated by the child's anxiety. And again, this is not pleasant for the kiddo and certainly not something where we're looking at fault or blame, but more thinking about how can we make sure we're reducing how this anxiety is taking a hold of our child and our family. Another benefit can be a relief to see a child be able to live more fully as anxiety reduces as well. And again, similarly, benefits for kiddos. Sometimes this is used as a standalone. Sometimes this is used to either supplement or come before individual so that parents and caregivers are feeling empowered and knowledgeable as that treatment is getting started. But for a kiddo, it really reduces the hold of anxiety in their day-to-day lives. It reduces time spent managing anxiety and improves their confidence and self-esteem. So that can be really powerful for them too. Okay. Next up, parent-child interaction therapy, or PCIT for short. So PCIT is an evidence-based intervention for kiddos all the way down to two, all the way up to about 7. It's designed to really enhance caregiver strategies for kids with social, emotional, behavioral problems kind of across that spectrum. What's really unique about PCIT is a large majority of sessions involve live coaching. So clinicians assist caregivers in learning specific skills to help support emotional regulation, positive parenting, behavior management. Typically, PCIT is done in about 2 phases. First is focused on developing skills to support a secure and positive bond between caregivers and kids. And again, a lot of caregivers are coming in, and that positive bond is something they've been working hard on. And you may already have a really positive bond, but we're increasing the level and the potency of that positive so that you have that. Because what's really cool is using positive attention in these ways and having, again, we're really working to tweak and support caregivers and how they're using that positive attention. And it's shown that tweaking that and using positive attention as our superpower in specific ways can address behavioral challenges by about 80%. So it's a really powerful tool. The second phase, after we really have that good foundation solidly in place, is then to learn strategies for discipline to help manage limits for your child, comply with directions, help them comply with directions, and demonstrate appropriate behavior. And then it really sets you up to have predictable and consistent approaches for managing this behavior, which also helps, I think, for any of us in high stress moments. Having very specific ways, predictable ways to help address it can be especially important when we are stressed ourselves as parents or overwhelmed, as opposed to being led by emotions. So how are sessions structured? So in these sessions, we usually have 2 sessions at separate points in treatment where we're teaching skills to caregivers for those 2 phases. The remaining sessions involve live coaching, as I mentioned earlier. So usually it can be done very successfully virtually. Sometimes in our office, folks are coming and we're able to observe and have something that the caregiver has in their ear to hear our feedback as we're coaching. Similar to BPT and SPACE, we're asking for weekly sessions to keep that skill work up consistently. Average length of treatment can vary, 12 to 25 sessions. I will say 12 is remarkably efficient. But again, we're really working to support caregivers and having these skills down pat. and have a very evidence-based and outlined way for how to help caregivers move through learning those skills and implementing those skills. But for any of our interventions, we're really looking for them to be time limited, to support caregivers in learning them, feeling confident in them, knowing how to implement them independently, and then being able to graduate and move on. So benefits for PCIT for a caregiver. There are more than these, but really enhancing the caregiver and child relationship. Again, lots of folks value this, and being able to improve that can help in so many different ways. And this can be impacted especially when you're having a child who's struggling with behavioral difficulties or other similar challenges. It decreases caregiver stress, which we know is at an all-time high. And that can really be remarkably beneficial for, I know, any parent, including myself as a parent, to have these skills and strategies for that reason. Again, increasing caregiver confidence, being able to know that you can be an agent of change around behavior. And we know with any kid and anything that comes in, behavior ebbs and flows. So to be able to have these skills down and know how to implement them now and in the future can be remarkably valuable. It also can improve your child's pro-social behaviors, frustration tolerance, and success in environments, which is really something that a lot of caregivers are concerned about and coming in for. And then benefits for the child. In this instance, the child is usually the one, still meets the clinician, but is really the one who is kind of doing the play and engaging with the caregiver. So less actively involved, but still the identified patient. But for the kiddo, again, enhancing the caregiver-child relationship, improving their self-esteem as they're doing better and being able to better manage certain situations can be tremendously beneficial. And this can be supportive not only with increased compliance and improved behavior, but also with addressing other symptoms, whether it be anxiety, traumatic stress, low mood. I will say too, we really start with implementing these in the home, and often we see this trickle into school, into other settings, as these skills are really taking hold. And similar to BPT, and even in space, we can also collaborate with schools to help with implementation and think about how these skills can really be implemented in those settings, which we know are different than home, but can have a very big impact in their success there too. There are some other modifications for PCIT to target other symptoms, which I have listed here. And I will say too, just in the typical course of PCIT, we've seen a lot of success for families and kiddos as they go through that and learn those strategies. Really, the power of positive, the power of using attention as our superpower is really something that can make such a tremendous difference, and helping caregivers tweak their implementation is really what we're looking to do and support with. And again, always individualized to each individual child and family. And then, as Olivia mentioned earlier, sometimes individual treatment is recommended as an intervention too. Sometimes we're starting here with certain kids that are coming into care depending on their presentation and concerns. And sometimes we're starting with a caregiver-based intervention like a BPT or a SPACE, and then moving into individual treatment to support parents first in knowing more about our approach, knowing how to support once the kiddo gets into individual treatment. And I will say too, regardless, even if we just have individual treatment as the recommendation, it is so important, and we find it so valuable to ensure that caregivers are involved in that treatment course as well. What this can look like is joining us in the beginning and maybe the end of session to really support caregivers and learning alongside their child, both about what we're doing, what they're learning, why we're implementing things the way we are, and really supporting and thinking through how we're having practice in between session, which is such a crucial part of evidence-based treatment. And that's where that partnership with both the kid and the caregiver is such an important part of our course of treatment and our long-term success. So I'm just going to briefly touch on some certain case examples. I'm going to keep some of the information minimal just for ensuring, families' privacy as well. But just a couple examples to paint a picture of how this has helped with different presentations. So we talked first a little bit about behavioral parent training, and we have a couple ways that this can help. This is certainly not an exhaustive list or example, but we'll start here. So one of the first families that I'll highlight had an elementary school age child who was experiencing a lot of oppositionality and also diagnosed with ADHD. And as we mentioned previously, BPT can really be a frontline treatment for this type of presentation and some of these diagnoses. The parents really talked through how there was conflict and arguments pretty much every night with their child. They had got medication in place for ADHD, which is also evidence-based. And also, they were still having difficulties with behavior, particularly when that medication wore off. So parents met weekly with their clinician, building on skills, and with some of the level of conflict and arguments, it was really challenging to have any positive moments. So really started first with implementing one-on-one time, so some positive time together with their child that is done in a very specific way to really increase the potency of those positives and give the child a lot of positive attention, particularly for those things that we want to see more of. That felt really good for the family to have that space and time, as well as for the child, which as a standalone can have a really big impact. Over time, they were able to build upon the different skills to make sure that they had a lot of positive ways to increase the behavior and clear and really consistent consequences for some of the negative behaviors as well. And they were able to really see a reduction. I think they estimated, and we do a lot of data collection, of around 60 to 70% decrease in the problematic behaviors. So we certainly know kids are still going to be kids and have challenges, but through the skills implemented, it really helped to make the challenges more manageable and really helped to make things feel consistent both for the caregivers and for the child. There was also another teenager we had who came in with a really low mood, was ultimately diagnosed with depression. And instead of jumping first into individual treatment, parents started with behavioral parent training with a real emphasis on those positive skills to help increase, again, the potency of the positive interactions between the teenager and their parents. And again, this is one of those spaces where it is not a parent's fault. And this is a place where parents can find different ways to really enhance the positive and really have an impact on what's going on for their child and think about what's in their circle of control for those moments. They were able to use labeled praise to really point out the things the child was doing well and really focus in on the characteristics, the motivation, and the little things that they were doing along the way. Starting with this also helped the teenager be able to participate in treatment because parents were able to really use some of those skills to really enhance and support the teenager in doing some of that homework around the skills in between session. We know with folks who have depression, motivation might be low, energy might be low. So having that teamwork with both the teenager and the caregiver to help with implementing some of the skills in between made a pretty tremendous difference. So again, it can be used in a lot of different ways, and we find it to really enhance treatment for a wide variety of presentations and really, really value that partnership with caregivers and see that really kind of take it to the next level for kiddos treatment too. And then thinking about space, we did have a teenager struggling with anxiety, executive functioning, which really impacted school performance and attendance at school as well, as they oftentimes either missed work and then wouldn't go to school, worried about how they'd be perceived by others. So the parent in this scenario really started with space in part because the teenager was not very motivated to participate in treatment. And also this caregiver identified that they themselves have struggled with anxiety. So navigating this was challenging in that regard as well, which I think can be a really common experience for caregivers. We know how uncomfortable that feels for ourselves. So it can be really challenging to think through doing anything other than accommodating and kind of reducing the distress of that anxiety. So the caregiver really engaged in identifying various accommodations. So doing things like driving their child to school, rather than joining the carpool, which was the typical approach, or avoiding doing things that the child might otherwise do just because that would increase the child's anxiety. So with the clinician, this caregiver learned a lot about anxiety, learned about how it can be maintained, and really found ways to gradually reduce the accommodation and also introduce that concept to the teenager so they knew, hey, this is what I'm going to be doing, and here's the reason. And it's really to support you and really take the power away from the anxiety too. So, really, a different way to approach exposure by really reducing the accommodation in the home, which can make a big difference. And so, this really supported in being able to help the child, help the teenager be able to participate more fully in school and in extracurriculars, and eventually really help the teenager be able to recognize anxiety as something that is we can externalize and think of as separate than ourselves. Lastly, PCIT. So one case example that I have is a toddler, preschooler, who was experiencing a lot of disruptive behaviors, separation challenges, trauma, disruptions in placement from their history. And in residing with their pre-adoptive parents, had experienced some really big behaviors, both at home and in their school setting. So PCIT and doing this coaching really helped caregivers find ways to have and set up what we call special time on a pretty much daily basis to have that positive moment with the child. And in using the labeled praise and special time, give them a lot of positive feedback and build skills they wanted to see around emotional regulation. And then after that foundation was set, support with having really predictable consequences for the child, while maintaining those high level of positive, potent engagement skills too. And this really helped to set up for this kiddo a very predictable environment, where they were able to really reduce the intensity of the disruptive behavior, which certainly both helped at home, but also really helped in their success in a school setting. We've also seen this be really helpful for a slightly older elementary age child who was experiencing oppositional behaviors and a lot of anxiety. And just through the course of that typical PCIT and supporting caregivers with both having those positive moments and also using labeled praise to focus on the positive opposites of the oppositional behavior and really build in some brave behavior, helped that child both reduce the level of oppositionality and be able to build their capacity to take on situations that were more overwhelming for them in different settings, by encouraging that parent and supporting them in implementing the positive strategies and using attention as their superpower. So we've talked a lot, but we've really just kind of hit the tip of the iceberg on some of these topics. So we did want to highlight our featured resources on our website, which has a lot of information, blog posts, various webinars that have dove into even more specifics about certain interventions or certain areas that families come in for treatment. So whether it be more focused on anxiety or ADHD or oppositionality, we encourage you to check out our website and the featured resources that can be found there. As I mentioned in the beginning, you can see a lot of these different webinars have been recorded in the past, and reference back and watch at your leisure if interested. Here are some research and resources, again, not an exhaustive list, where you can find more about some of what we discussed today. So the NCTSN website has some breakdown of various interventions, space treatment if you wanted to go directly to the source to learn more, and then CDC, and also CHAD, which focuses a lot on ADHD. And then we have some additional resources and research here that we used for our presentation today. And as always, you're welcome to reach out to our center if you have more questions following our presentation or interested in learning more about our services. we invite those conversations and certainly can speak more as questions come up. But speaking of questions, what questions are coming up for folks? If any.
Hi, thank you so much. This has been really helpful. I'm a licensed graduate professional counselor in Maryland, and I'm wondering, do these require specific trainings, right, to be able to provide or to be able to say that I'm providing behavioral parent training? Do I need to be certified? Like I know PCIT has a certification process. Does SPACE and BPT as well? And is it ethical to try to use some of these principles without having the training?
That's a great question, Lauren. So we're fortunate here at our center to be able to do what's called match training, which is essentially a focus of CBT and involves an overview of BPT or behavioral parent training. We also have a couple clinicians in our clinic who have completed SPACE training, but have certainly been able to benefit from learning about the resources through a variety of ways. So in terms of like the ethics of that behind it, I think I'm not in the position to necessarily say there is only one way to get trained in these strategies. I would go to the SPACE website to kind of take a look at resources to see if there's things that can be more commonly incorporated in. Similar to BPT, some of the resources that we've recommended to parents to learn more about our Barkley resources. So Barkley is the name of an author and someone who has studied this, and there's some like easier to read books on it that can provide an overview of the strategies and also provide an overview of the interventions that I might recommend taking a look at as well. And some of those resources, yes, Olivia's putting the book in. Thank you for the tag team, Olivia. And so there's a couple different resources too that are both helpful for families and also for professionals to reference back to.
Thanks.
You got it.
I have a question.
Yeah.
My name is Christine Weitzel. I'm a clinician over at Needham Youth and Family Services. I'm wondering if you could just speak to the way you go about when you're meeting with addressing parent or caregiver intervention strategies with a parent that perhaps themselves have experienced a significant level of trauma or having difficulty really with their own sort of regulation in terms of managing stress and anxiety or other maybe mood disorders. How do you sort of try and help in that way? I know it's a sort of a broad picture, but a lot of my clients, I'm finding in terms of trying to do the parent-child interaction, it's oftentimes the child might have brought them into treatment, but it really is compounded by whether it's a generational trauma issue or really significant issues that the parent themselves have and haven't quite been addressed.
Yeah, I think that's a great question, Christine, and I'll start and Mary can jump off because definitely this happens all the time. I think Mary talked about it in the context of anxiety, but it's the same thing for trauma, or lots of other things that follow those generational patterns. And I think like some of the things that Mary cited in terms of caregiver benefits, particularly for something like PCIT, BPT, is that there is this added benefit of helping parents own mental health symptoms a lot of the times, especially I know that's a case in PCIT. So I'll cite that to parents. And I think part of it is that it's another treatment barrier to implementation if parents are kind of struggling with their own mental health concerns that they need to manage in order to effectively implement the strategies that we're talking about. And we'll just name that with parents most of the time. Talk about the strategy, talk about what makes it hard, practice it, role play it, validate that, and talk about the rationale really being that, like, yeah, it's going to take time, but then this is them working to break that pattern of generational trauma, or generational things to overcome. We might review some very basic coping, sort of emotional coping strategies with parents, to the point that we keep it pretty simple and focus just on how using those coping strategies in order to do the implementation of the child focused strategy. And then if it becomes clear that parents need a lot more support outside of that to engage in treatment, we'll often make recommendations for parents to seek their own individual therapy, and talk about that with parents as like, in order to do this treatment for your child, we need you to also be doing this work alongside or before that. Mary, I'm not sure if you have other things to add.
No, I think that was well said, Olivia. I think we're always going to want to support the parent, and I think that's such a common piece in the room, is their own experience. And I think there's like, a spectrum of what we see there. Of course, like you had kind of highlighted, Christine. I think we also have a lot of parents or caregivers come in who mention, whoa, this is way different than how I was raised. And so even if it's not, something more significant that has impacted them or symptoms that are impacting them, they're shifting something. And at first it can feel really counterintuitive. And so I think that's where we are always working with the family, the caregiver, to really pace how we're implementing, to really think through. And a part of the introductory modules that we're introducing is really thinking about behavior, but also thinking about the caregiver in the context of behavior, whether it be their experiences, whether it be, my frustration tolerance in this situation is more challenging, or I was raised in this way and this feels very different than the skills you're teaching me. It can just provide that opportunity for conversation about what's different, and then help meet them where they are, to really think through how can we really implement this at a pace that meets you where you are, or helps think about how this is feeling off for you, and kind of really think about whether it be your cultural background, your lived experience, and other things that might have influenced the way you were raised, so that we can help to kind of pace it in that way too. So just another perspective on that as well.
Thank you both very much. I appreciate it.
Thank you. All right, we've got about another minute or two left. Are there any questions before we wrap? All right, everyone. Well, we really appreciate all of the time. Again, some of the things that we touched on today were really tip of the iceberg. There's a lot more to dive into to get into the nitty gritty. So feel free to head on over to our website for some more resources on this topic, to go a little bit more in depth. Again, as a parent, parenting is hard at baseline, and especially when you have a child who is struggling in some way, to be empowered with different skills and strategies we've seen as incredibly impactful. So we appreciate you being here, hearing us out, learning a little bit more today. And thanks again.